It's been 5 years since the World Health Organization officially declared COVID-19 a pandemic.
The virus disrupted daily life, strained hospitals and the healthcare system, and reshaped the world as we see it today. Despite the efforts taken, though, COVID took a devastating toll.
The CDC says close to 150 million cases of the virus were reported in America since the start of the pandemic, leading to roughly 1.2 million deaths.
Just in Ohio, nearly 45,000 people lost their lives.
And half a decade later, its impact continues to shape our daily lives.
But is it truly over? And how have these changes affected us as a society?
Well, from remote working and shifting the social norms, Valley doctors say the virus has left a lasting imprint on how we live and interact. As we reflect on the past 5 years, it's clear that COVID-19 reshaped our world in ways we're still navigating. The pandemic forced a rapid shift to remote work, and today, many employees are reluctant to return to brick-and-mortar offices. Dr. Deirdre Aducci says this trend has both positive and negative effects.
We feel as though we're more productive, we're getting more done, but we're using less of our muscle in interacting with other people.
While some feel less stressed working from home, Aducci says others are experiencing more isolation. Meanwhile, businesses have adjusted, many shortening store hours. Aducci says COVID also deepened societal divisions. Vaccination debates have turned political, and the overall tone of public discourse has become more aggressive.
I think people are more entitled, but they're also being more aggressive in how they're expressing themselves. So remember, assertiveness is a good thing. We're able to express it. We're respecting someone else. Aggressive means I'm expressing it how I feel, but I feel as though I can run over your feelings in order to get my feelings out.
On WFMJ Today this morning, Dr. James Kravick said while vaccines remain a critical tool in public health, distrust has grown. A recent poll found more than half of Americans believe officials misrepresented vaccine efficacy.
I believe in the science of vaccines. I believe in the science of public health. The science hasn't changed. We still need to get our vaccines when we're supposed to get our vaccines as a kid and as adults.
Kravick believes COVID's here to stay and may be seasonal.
The good news is it's not deadly for the most part, just like flu isn't deadly for the most part, but it's a nuisance. It can be very severe.
Now, despite the ongoing concerns, both point out that many pandemic-era habits remain, such as more hand washing, masking, and people being more prone to stay home when sick.